My name is Liz Alderman, and I am the co-founder of the Peter C. Alderman Foundation. Our youngest child, Peter, was murdered on September 11th, 2001, in the attacks on the World Trade Center. Peter loved life, and there was nothing we could do for him. But if we could return life to people in Peter's name, there would be no better memorial. This set us on our journey to create mental health care for people where there was no care available at all. Northern Uganda has suffered terribly over the last 20 years. Prevalence of depression and PTSD in the north is just rampant.
The context in which PCAF has developed this service package is addressing a specific need within the refugee and national population which the General Health Service has not been targeting. Their focus is on other issues in health, malaria, HIV, safe delivery, and all that.
We have learned that there are so many mothers in northern Uganda, for many reasons, suffer severe depression during pregnancy. This can be caused by their lives prior to their becoming pregnant, by their being interned in camps, by the trauma that they experienced during the unending wars in the north. We are focusing our research with pregnant mothers because there are so many women who desperately need the help that we're going to provide.
When you develop mental illness, people in a family setting and a community setting always try to move left and right to see what they can initially do to identify the cause and fix the problem. But because mental illness is not well understood, if this sufferer continues to harbor the illness for some time, then she's abandoned.
PCAF's maternal mental health program will bring to scale a new, evidence-based, low-cost intervention. We will train community health workers to teach pregnant women self-care and stress reduction techniques. They'll screen and refer pregnant and new mothers at risk to PCAF trauma clinics for counseling, group therapy, and psychiatric care if needed. Mothers and babies will be followed from the second trimester through the first 2 years of life.
I get a lot of referrals and consultations to see mothers in the maternity ward. Mothers who are getting low and low and low in their moods. Mothers who are refusing to feed their babies. Mothers who are turning against their babies.
So many of them suffer from postpartum depression or the continuing depression that they had from the beginning, that they don't take care of their child.
Yes, we offer mental health services. We offer more general mental health services. But PCAF has come in to say now, why don't we also look at what? Psychotrauma, and with their specific emphasis on psychotrauma, which has not been the focus of many. I think this is where they fit so well. First of all, to be able to throw light into how big the problem is. It's not on top on the priority list. It's not on top. But through our efforts, we are drawing attention. We're drawing attention that it's necessary to address mental health issues of communities, of persons.
I feel so fortunate to have met the people who have come into my life since we started this work. And so I know that bringing help to people, returning people to function, can completely change their lives. When you have a purpose, you begin to care about life again. You begin to feel better about yourself. you feel better about your life, and you begin to have hope for the future.